Hello everyone, so I'm going to be presenting on the slap tear. Alright, so slap is obviously an abbreviation. Oh, okay, hello. Slap is obviously an abbreviation. It doesn't just happen from someone like slapping someone in the shoulder. So it stands for superior labrum from anterior to posterior, and that basically just explains the location of where it happens. I'll show you on the next slide. Right, but so it happens anteriorly and superiorly, so this is the tear right here, and it's on the labrum, which is in the glenoid cavity. And that brings us into the anatomy. So it affects the labrum in the glenoid cavity, and the long arm of the biceps brachii tendon can also be a secondary anatomy for it, right? The long arm is the one that kind of goes like this, and then the short arm is the one that kind of goes like this. So here's a really good picture to show it. So here is the long arm of the biceps brachii tendon. Here's the labrum right here, and you can see that it kind of attaches like right above the labrum, like the superior part of the labrum, which will be important for later. So there's multiple different types of slap tears that vary in severity, like many other sprains or like tendon tears, things like that. So type 1 is obviously the least severe with just like a little bit of tearing. And then type 4, this is called a bucket tear when like half of it comes off like this. But as you can see, this is the biceps tendon, and it kind of pulls it off with it. So that's why it's a secondary anatomy for it. So the mechanisms of injury, the most common one that athletic trainer is probably going to see is a dislocation, just because it happens pretty frequently in sports. And when the humeral head kind of comes out of its socket, it's going to damage the structures around it, like we've talked about with other dislocations. It can also happen from direct trauma, for example, a car accident, a foosh, right, because you're putting a lot of pressure on your shoulder when you go down on your hand like that. And it's actually very common in geriatrics as well, so a lot of people get it when they're older just from normal wear and tear of being old. And also repeated arm movement over the head, which is important for what different types of sports that people usually get slap tears in. So for signs and symptoms, they're going to feel a locking, grinding, popping sensation. It's going to feel very uncomfortable up in their shoulder because the thing that's keeping the humeral head in place is not intact, like it's not working as correctly as it should, so it's not going to be like a smooth, like rotating kind of. You're also going to have pain lifting objects overhead, just because, like I said, like your arm is trying to rotate and it can't really rotate well if it's not able to like smoothly like move around in there. You're also going to have decreased strength and range of motion. A previous dislocation can also be a sign, because it happens a lot with dislocations. You're also going to have an unstable shoulder, and you might feel like the shoulder is going to pop out of the socket, right, because the labrum keeps it in the socket, so if that's not working correctly, then it's going to feel kind of loose in there. You also may feel a dead arm sensation. This basically means that like the nerve is kind of affected. Their arm just like doesn't feel right, like their shoulder doesn't feel right. It may also be uncomfortable sleeping on your affected shoulder, just because you're laying on it. And a positive MRI is also very indicative of it, because if you have all these other symptoms and your doctors aren't sure like how bad it is or something, then an MRI is what they're going to do. So for special populations that it occurs in, you've got different types of athletes, baseball pitchers, weightlifters, volleyball. All these people lift things repeatedly above their head, so that's why it's going to happen to them. And then geriatrics, just because, like I said before, normal wear and tear of your body is not perfect. After a while, it's going to start to break down a little bit. So for special tests, there's a lot of different special tests. I didn't name them all here, but there's like dozens of different kinds of special tests. But I'm just going to tell you about the Crank test and O'Brien's test. So for the Crank test, you're going to lay your patient supine. You're going to put your hands on their shoulder and they're gonna kind of lay like this with their arm back like this, and you're gonna put your other hand on like their elbow right here, and basically you're gonna like push their humeral head forwards. You can kind of think of this like McMurray's test for the knee, right? Because you're kind of like moving it like that, and you're also going to externally rotate the humerus. And it's also like McMurray's test in that the positive test for it is like a grinding sound, because nothing is smooth in there if you have a slap tear. For O'Brien's test, the patient is going to be sitting up or standing. You're going to place your hand on their forearm, and you're going to ask them to do 90 degrees of shoulder flexion, so that would be like this, as you can see, and slight adduction, so kind of like this, and they're going to internally rotate, so that would be with the thumb down, and you're going to put your hands at the distal part of their arm, and ask them to push upward, and you're going to resist their arm. And a positive test for it is going to be deep pain. Now, the deep part is important because superficial pain can be indicative of other shoulder problems, so that's why it's not like 100% accurate, but if it's like really deep pain and they know like what deep pain feels like, then it should be indicative of a slap tear. So for treatment, most treatment is non-surgical. It's going to be NSAIDs and rest and physical therapy to strengthen your rotator cuff muscles. But if it's like a type 3 or 4, as seen here, this is a type 4, probably because the biceps tendon is like pulled off. And this is a picture of an arthroscopy, which is basically when they, take a little thing and they go like look in your shoulder, and it would need to be stitched up with surgery. And there's other surgeries that you can do if it's like really, really bad, but arthroscopy is the most common for it. So for your prognosis, most people will feel decreased like shoulder pain and increased shoulder range of motion after they get treatment. And I saw the statistic that said athletes can expect to return to 80% of their level of play if it's pretty bad after they've gotten treatment. And the reason why like the recovery time is different for everybody is because of like the different severities and also of like the wide range of age groups. So you can have like kids getting it, or you can also have like really old people getting it. So it just depends on also how they got it as well. So for prevention, you're going to want a good warm-up before your activity. You're going to want to strengthen your shoulder muscles, especially your rotator cuff, as I said before, to keep your shoulder strong. You're also going to want to learn proper falling techniques if you're playing a sport that falls a lot, right? Because if you're landing on your hand all the time, that will create a lot of different problems for you. For baseball specifically, you're going to want to regulate pitch count. And for baseball and softball, you want to practice proper throwing techniques so that your shoulder isn't moving in really weird ways. And that is it. Thank you very much for listening.